So there are quite a lot of controversies when it comes to ART. So basically, there are many women who are really deserving for these particular treatment, and we need some more clarity. So just to get more highlights on these things is my whole idea of this. Standardization is a must, especially like when we are dealing with fertility. So basically, like we need to set a mandate rule as like what are the basic requirement, like because there are mushrooming of many centers here and there. So we need to just standardize and say like these are the particular protocol, I mean set rules which needs to be, should be they available for a person to start a fertility center. So that is really, really important. No, it is very difficult unless and until you have the proper data. It is very difficult for them also to come up with certain rules. So that is the reason ICMR is constantly asking us to update their data and send it across to them, and which we are doing that. So that is really important for them also to set a certain kind of a rule. See, that is the biggest problem, but then we can make it really affordable. So we, IVF major advantage is like we cannot, there is no set rate like this is what is going to be the rate for the patient. So patients who are really not affordable, we can be a little more flexible and then charge to them just probably the treatment charges, and so in that way we can make it really reasonable for them. See, basically it is just that our goal is only a pregnancy. If that is our ulterior motive, I think it can be done even for the real poor patients. Yeah, probably like how you have some government insurances which is happening for other diseases. If they could also come out with some kind of an insurance policy for these IVF patients also, then it would really help them in a real long way, especially for the really deserving and poor patients. See, basically it is all a standardization and how we can make our services affordable to our patients, and it is also the rules and regulations that one needs to follow while doing this ART procedures is what we really come to understand.